Hi everyone, welcome back to my YouTube channel and today we are going to talk about lacrimal bone. So let's start our topic with introduction. Lacrimal bone is a small, thin, paired bone of facial skeleton. Despite being the smallest and most fragile bone of the face, it plays an important role in formation of medial wall of orbit and drainage of tear from eyes into the nasal cavity. Location and structure of lacrimal bone. As you can see in the diagram, they are located in the anterior part of medial wall of the orbit, between frontal process of maxilla and orbital plate of ethmoid bone. Each lacrimal bone is rectangular in shape and has two surfaces, lateral surface and medial surface, and it has four borders as it is rectangular in shape. Parts of lacrimal bone. If we will talk about its surfaces first, then we will talk about its border. So first surface of lacrimal bone is orbital surface, that is also called as lateral surface. This surface is smooth and forms part of medial wall of the orbit. This contains a vertical groove, that is a lacrimal groove, which along with frontal process of maxilla form the lacrimal fossa. Lacrimal fossa houses the lacrimal sac and that is an important structure in tear drainage system. Next part of lacrimal bone is medial surface. That is rough and irregular surface. It contributes to formation of middle meatus of the nasal cavity. It is related to ethmoidal air cells. Now let's talk about borders of lacrimal bones. It has anterior border, posterior border, superior border and inferior border. Anterior border of lacrimal bone articulates with frontal process of maxilla. Posterior border of lacrimal bone articulates with orbital plate of ethmoid bone. Superior border of lacrimal bone articulates with frontal bone, and inferior border of lacrimal bone articulates with orbital surface of maxilla, thus completing the nasolacrimal canal. Articulation of lacrimal bone. Each lacrimal bone articulates with four bones. They articulate superiorly with frontal bone. They articulate posteriorly with ethmoid bone. They articulate anteriorly and inferiorly with maxilla, and they articulate in the nasal cavity with the inferior nasal concha. Functions of lacrimal bone. First function is formation of orbit, as this bone contributes to the medial wall of the eye socket. Second function is tear drainage, as this bone forms part of the lacrimal fossa that houses the lacrimal sac which drains tear into nasolacrimal duct and finally into nasal cavity. Third function is facial skeletal support, as this lacrimal bone contributes to stability of orbit and nasal cavity. Clinical significance of lacrimal bone. First is fracture, as being thin, lacrimal bones are more prone to fracture in orbital trauma. Second significance is tear drainage disorder, as obstruction of nasolacrimal duct may cause excessive tearing or infection. Conclusion of this lecture video. Lacrimal bone is smallest bone but functionally significant bone of facial skeleton. By forming part of medial wall and housing the lacrimal sac, it established the connection between ocular and nasal systems. Though delicate, it plays an essential role in tear drainage and orbital structure. And this was all about lacrimal bone. Hopefully you liked the video. If you do, don't forget to like, share, subscribe and comment. Thank you for watching.